Dr. Gautam Pinge. I am a consultant physician and internist practicing in the area of Malad, suburbs of Mumbai for the past 8 to 10 years. And the hospitals that I'm attached to are Evashine Nursing Home, Suchak Hospital, Criticare Asia Malad, and Gokuldam Medical Center. So I'm going to have a small discussion or awareness talk to you on the occasion of this World Hepatitis Day and few facts and do's and don'ts about what we should do about hepatitis. So hepatitis, what is basically hepatitis is it's an inflammation of the liver and liver tissues, and hepatitis is caused by a variety of organisms. It can be basically virus related or it can be non-virus related, lifestyle related. Lifestyle related as in people having fatty liver, developing into NASH or steatohepatitis, whereas viral hepatitis are caused by type of 4 viruses which commonly we encounter. 2 are waterborne, hepatitis A and E, whereas B and C are blood-borne or sexually transmitted diseases. WHO study found that about 4.5 million of premature deaths could be prevented in low and middle income countries by 2030 through vaccinations and proper diagnosis, timely diagnosis of hepatitis, which might lead to complications in future. So basically the patients that might come to you have got some signs and symptoms. So symptoms of the people with hepatitis are that people might have jaundice, which is yellowing of the skin, sclera, and the connective tissues. Patients might have fever, fatigue, tiredness, nausea, vomiting, abdominal pain. The urine might be dark colored, clay colored stools. This could be the commonest things. And the causes of, like I told about the hepatitis, is if it's a viral borne hepatitis, like hepatitis A and E, it's a fecal-oral route spreading basically through water or waterborne or foodborne diseases. Symptoms are same in both hepatitis, either it's A or E or B or C. The B and C hepatitis generally happens via sexual contact or improper blood transfusion or body fluid coming into contaminated body fluids coming into contact with a normal person. Again, the symptoms are same. Vaccination is available for B and C, so which nowadays it's included in the vaccination program to vaccinate for hepatitis B and C. Whereas, like we said, hepatitis E is again a fecal-oral route, and the treatment for A and E is quite simple: rest and supportive treatment. Whereas for B and C, there are various oral medications as well as injections available in the market which we need to use. And like we are saying about do's and don'ts, the do's are we have to take sufficient precautions, a well-balanced diet, cleanliness maintenance should be there around, drinking proper water intake should be there around 1 to 1.5, 2 liters of water intake in a day. Avoid tobacco, wash hands, maintain proper hygiene, cover open wounds, discard the used syringe in a proper way. No reusing of syringes, be that patient, if patient is a diabetic or patient is taking home injections, the syringes should not be used. Patient should get vaccinated if he is not vaccinated. Get tested for hepatitis during any pre-operative checkups or pregnancies. Practice safe hygiene and to avoid sexual transmitted diseases. And don't use any personal items of any infected person. Don't share razors. Do not donate blood without a proper screening and following the proper protocols. Avoid drinking alcohol if a person has got underlying non-specific fatty liver or steatohepatitis. Avoid traveling along with an infected condition and maintaining poor hygiene. Don't eat or drink contaminated food, and don't take overdose of acetaminophen or any drugs which can affect liver if you have an underlying liver disease. Thank you.